Tuesday on Kababayan LA, and we are talking about our health, your health, very important. Pangalagaan niyo po yan. Dr. B is joining us today on Kababayan LA, taking your phone calls. First caller is joining us from Huntington Beach. Tesla is on the line. Hi, Tesla.
Hey, hello, Janelle.
Yes, go ahead with your question.
Yes, Dr. B, I am just asking a question regarding the difference between the common cold and the whooping cough, because I have a patient who is a senior citizen, and she actually has congestive heart failure. So I was just wondering if I recognize, because she has this cough for about a week now, and it's a hacking cough. So I was just wondering if I'm ruling it out as a whooping cough, or is there anything I can do, or just maintain that she has the common cold?
All right, very good question.
Yes, very good. Common cold, as I said, there are 52 types of common colds, and they are less serious than what you mentioned, the whooping cough. The whooping cough is usually, as I said, from the RSV, respiratory syncytial virus, and in those cases where you have severe signs and symptoms, you have to really consider adding antibiotics in patients who are prone to bacterial infections, like the immunocompromised and the elderly.
Okay. Doc, ano pong pinagkaiba? Let's talk about specifics, no? Symptoms. How do you know if you just have common cold, or how do you know kung meron kang whooping cough?
The whooping cough, as you said, is whooping cough. It's a continuous cough, whooping in character, where it's continuous and it's very hard for the patient. Common colds, you have only the symptoms of rhinitis or redness in your eyes, nasal congestion, and a mild cough.
All right. Okay. Next caller is Manuel, joining us from Covina. Magandang hapon sa'yo, Manuel. Are you there?
Yeah.
Yes, go ahead. You're on the air. Go ahead with your question.
Yes, Manuel from Covina. I just want to ask if you have a sipon or something like that. Ano bang ilang tubig ang glasses of water a day should you drink, or you're dehydrated? Thank you so much.
Thank you. Yes. Nakakatulong ba ang tubig, lots of tubig, pagka may sipon?
As I have said before, a lot of fluids. It doesn't have to be water, orange juice, apple juice, but the minimum requirement, if you have these symptoms, you have to have at least 8 ounces glass water in a day. That's the minimum. And as you said, dehydration is also a common complication when you get sick of the common cold.
Bakit po? Bakit po yun na nagiging complication? You don't feel thirsty?
You seem to be congested. You lose a lot of fluid when you breathe more, because it comes out through your lungs. And that's, you never feel that you're losing water. And if you don't drink, then you get dehydrated.
Right. Thank you for answering those questions. Bukas po ang aming mga linya ng telepono. If you want to consult anything, Dr. B is here to answer all that. Not sure if we have another caller on the line. Third caller? Hello? Okay, we'll get to the calls later. Dr. B, you mentioned din kanina, no, yung influenza. Kung hindi pa sila nakakakuha ng shots for that, dapat nakuha na nila. So you strongly recommend, because a lot of our kababayans, and I know we talked about this before, they don't believe in that. In fact, they think na the more they take it, the more na nagkakasakit sila.
The vaccine, or the flu vaccine, is not being given only for nothing. This is a serious problem that we have. It's the WHO, or the World Health Organization, is involved in this. They determine what is to be in that flu vaccine.
Okay, and ano raw yun? What is the flu vaccine?
There are 3 components of the flu vaccine that we have. It's no different from last year. The most common causes of influenza are type A and B. The type A, which is the H1N1, we had a pandemic in 1999 and 2009, and the H3N2, those are type two types of
Influenza.
influenza A, and the other one is influenza B. Those are the three components which the WHO think that it's the major virus that will cause some infection in our community this year.
And yeah, that's what the vaccine or the shots
Yes.
addresses
And
or
it
will
will
address.
prevent those at least three kinds of viruses. And it's not a sure guarantee that you won't have the flu, because
Right.
there are other viruses out there. But these three major viruses, these are the ones that are prevented by this current flu vaccine for 2011-2012
All
flu
right.
season.
Okay. Thank you so much for explaining that to us. More from Dr. B and more of your questions when we return on the show. Don't go away.